So it's my pleasure to be here to present on behalf of my co-investigators the results of the OPTIMISMM trial in relapsed refractory myeloma, not least of which because of the very substantial contribution made by our European partners in this international multi-center trial. And just to remind the audience, this was a combination of pomalidomide, bortezomib and dexamethasone compared prospectively to the active control of bortezomib and dex in patients who are relapsed refractory to prior therapy, and there were 1 to 3 prior lines. So this constitutes a really interesting and important area now, because obviously with so much lenalidomide being used up front appropriately, because it's clearly so highly effective, as well as lenalidomide maintenance, once lenalidomide fails a patient, the question then becomes what's the best go-to at that point. Obviously a lot of choices, but in terms of the phase 3 data that provide the highest level of evidence for supporting a particular approach, OPTIMISMM constitutes a first of its kind because it looks exclusively at lenalidomide exposed patients, and in fact 70% of our patients were lenalidomide refractory, so very much a real world study. And what we were able to show was that the 3-drug combination was substantially more active than the control. The response rate for pomalidomide, bortezomib and dexamethasone overall was 82%, substantially less for bortezomib and dexamethasone. And when we looked at the one prior line of therapy, the patients in that group enjoyed particular clinical benefit. And not only did they enjoy a 90% response rate compared to 50% for bortezomib and dexamethasone, but also their progression-free interval was long at 10 months. For the study overall, it was about 4. So the hazard ratio for the 1 prior line was pretty impressive at around 0.5. Hazard ratio overall was around 0.7. So very encouraging data overall for the study, and certainly guiding clinicians as to best choices after early relapse.